Hemothorax. Presence of blood in the pleural cavity is called hemothorax. In a patient of hemothorax, the hematocrit of the pleural cavity is greater than 50% of that of the peripheral blood. Attention: hemothorax refers to hemothorax that results from massive intrathoracic bleeding, causing ipsilateral lung compression and mediastinal displacement. It usually occurs from penetrating or blunt trauma to the chest. Causes: a hemothorax that results without any trauma is called spontaneous hemothorax. This can occur in intrathoracic malignancies, usually occur with thoracic wall tumors, such as schwannomas or neurofibromas, soft tissue sarcomas, hepatocellular carcinomas, with thoracic invasion or metastases. Spontaneous pneumothorax, leading to hemopneumothorax. Anticoagulants. Vascular rupture such as aortic dissection, rupture of arteries during angioplasty in thoracic, and pulmonary arteriovenous malformations. Hematological abnormalities, such as hemophilia. And connective tissue disease, such as Ehlers-Danlos syndrome. Mechanism of hemothorax. When blood enters the pleural cavity, it interferes with the normal movement of the lungs, preventing them from fully expanding. This affects the normal oxygenation of blood. Since blood lost into the pleural cavity can no longer be circulated, the body tries to compensate by forcing the heart to pump harder. Each half of the thorax can hold more than 25% of an average adult's total blood volume. Clinical presentation. Patients of hemothorax present with anxiety, rapid breathing, and restlessness. Signs observed may include tachypnea, tachycardia, palpitations, shock, and pale, cool and clammy skin. On general examination, the patient may be disoriented or have altered consciousness, post-trauma in traumatic hemothorax. Neck veins may be flat and breathing sounds reduced. On examination of the respiratory system, a dull note is found on percussion of the chest. If the lung is collapsed, a resonant note will be heard in the surrounding space. Massive hemothorax, over 1.5 liters of blood initially, when an intercostal drain is placed, or a bleeding rate greater than 0.2 liters per hour can result in shock. Diagnosis. On an erect chest X-ray, a hemothorax is suggested by blending of the costophrenic angle and opacification of the affected half of the thorax. In supine position, blood settles down and appears as a hazy film. Ultrasound is more sensitive than chest X-ray. It is used in the critical care and emergency settings. Treatment. Minimal collection of blood, defined as less than 300 milliliters, in the pleural cavity, generally requires no treatment. Blood usually reabsorbs within a few weeks. For moderate and severe cases, with an aseptic approach, the tube is placed posteriorly towards gravity-dependent fluid, in the fourth or fifth intercostal space, between the anterior and mid-axillary line. The thoracostomy tube is then connected to a water seal and suction, to facilitate rapid drainage and prevent air leakage. Furthermore, tube insertion provides for blood quantification, to determine if surgical intervention is needed. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.